Well, welcome to our quarterly ICA Idaho Caregiver Alliance webinar. This one is a caregiver briefing, policy and systems update. And Edwina, if you could take the slide down for just a moment, and if folks have the capacity to turn on your cameras, if we could see faces just for a minute, would love to give a greeting and welcome you all into the room. So if you can turn on your camera, that would be just fabulous. Oh, it's nice to see faces. Yay. And if you wouldn't mind putting, if it's easy to do, if you could put your name and kind of area of the state you're in, in the chat, we'd love to get to learn a little bit more about you today as well. So again, welcome to this webinar, and just delighted to see so many people in the room. Not to embarrass anyone in particular, but Carrie Ann Fallow, are you able to turn on your camera? Carrie Ann is the new director. Oh, hi there, director for the
Sorry, I was just
AARP
checking my settings here, but thank you.
Yeah, welcome to
Thank you.
the AARP Idaho organization, Carrie Ann, and we look forward to working with you.
Thank you. It's an honor, and I'm so privileged to get to work alongside Lisa.
Yes. Great team. You have a great team that you're joining there.
Thank you.
Well, super. Thank you again for turning on your cameras for those that you can. And again, if you can put your name and where you're located in Idaho or outside of Idaho, would be happy to put that information in the chat for us. And Edwina, I think we'll go ahead and get started. Again, welcome to our quarterly webinar, and this specifically is looking at policy and system updates. Next. And it's sponsored by the Idaho Caregiver Alliance. And the Caregiver Alliance, we're 12 years in the making here, almost 13, and really here to serve as a voice and a convener for family caregivers. We are the only organization in Idaho that represent caregivers, family caregivers across the lifespan. And we take that role very seriously. And this webinar in particular is really designed to help all of us stay informed about recent policy changes that are occurring, and also how we can best use our voice to communicate our own personal issues, as well as speak for family caregivers as a population that is of great value to Idaho. Next slide, please. One of our signature programs of the Idaho Caregiver Alliance is the Family Caregiver Navigator program. And we encourage all of you who may need a connection and support to contact the navigator. Jennifer Glenn is on this call. She is our primary navigator. Sheila Weaver is also a key component of making the Family Caregiver Navigator program work, but it's free, and it's designed to help support family caregivers where they are and when you need it. So please, as needed, please reach out. So today we are joined by two amazing individuals that have been very engaged in policy and networking in Idaho for a number of years. Lisa Anderson is going to kick off our session today, speaking about recent policy or policy work underway, as well as how we can use our voice, and then Brittany Shipley will follow. So Lisa has worked for the Idaho legislature as the director of consultant services for two congressmen, one Republican and one Democrat member of Congress. So she walks both sides of the aisle, which is really important these days. I think we need to cross communicate as much as we possibly can. She's also directed multiple political campaigns. And she's worked for the vice president for government relations for the Idaho Kumho Mining and American Kumho Mining Corporation. So as you can see, she has a tremendous background in listening and in speaking with policymakers. Currently, she is the director for public policy, or she was the director for public policy for the Alzheimer's Association, and she now directs the director of advocacy for AARP Idaho. and she sits on the board of multiple nonprofits and also coaches a dynamic Special Olympic basketball team. Thank you, Lisa. And Brittany she lives and breathes the caregiving world as a mother of two children who have some special needs. She walks this path on a daily basis. She is a parent and advocate with background in social work and extensive experience as system level policy and governance. She serves as the director of the State Independent Living Council currently, as well as a variety of other state level boards and committees related to behavioral health and juvenile justice policy. She's also on our county's community loss team, supporting families and schools and communities in crisis as they recover and reconnect after loss. With that, I'd like to introduce, I'm going to turn the time over to Lisa. I did forget to introduce myself. This is Sarah Taves, been with the Caregiver Alliance since the beginning. And again, just really delighted to have all of you in the room. And with that, Lisa, I will turn it over to you.
All right, Sarah, thank you.
You are so welcome.
So before we begin, I wanted to give you a little bit of background as far as caregiving for me. My father, the reason why I made the transition from the mining field into the Alzheimer's Association is that my father was diagnosed with Alzheimer's, and navigating that road was incredibly difficult with my family. My mother succumbed to health complications from being a caregiver to my father. And from that, I had the honor of caregiving for my mother for nearly a year of her last remaining moments here on earth in my home, as well as working full time during that time. So I understand the hardships and the sacrifices that our caregivers make every day. So if we could go to the next slide, please. So 4 kinds of people: those who have been, those who currently are, those who will be, and those who will need caregivers. I love this quote. I like to throw it up there. Keep that in mind when you're talking to our legislators. Many of them are one of the 4. Next, please. I will try to go through these fairly quickly in the interest of time. But at the end of July, AARP and the National Alliance for Caregiving released their 2025 edition of the Caregiving in the United States report. So this shows us who our caregivers are. 63 million Americans are family caregivers. That's 1 in 4 adults. 61% are women, 39% are men. The average age of family caregivers is 51, but nearly half of them are under 50, which most people don't expect. 29% of our caregivers are in the sandwich generation of caregiving. 18% of family caregivers have a disability themselves, and 27% of our family caregivers are caring for someone with dementia or a cognitive impairment. As we know, family caregivers face a variety of challenges, balancing caregiving responsibilities with other obligations like parenting kids or working. And they also face high out-of-pocket costs that strain our budgets. Caregiving also can be physically and very emotionally draining. So let's dive deeper into some of these challenges briefly. Next. All right, so financial strain. About half of family caregivers, about 47%, experience at least one negative financial impact. So 31% stop saving, and 24% use up personal short-term savings, 23% take on more debt, 20% leave bills unpaid or pay them late, and 17% usually end up borrowing money from family and friends. Some of the group of caregivers disproportionately experience negative financial impacts, and those include our African American, Black, Hispanic, Latino, lower income, and younger caregivers. The average out-of-pocket expenses, as many of us probably know, yearly is $7,242, of their own money they spent on caregiving expenses each year. Next, please. So time, it's a big challenge. Nearly 1 in 4 caregivers provide at least 40 hours of care per week, and 35% of caregivers provide care for more than 20 hours per week. Caregiving continues to grow in scope, intensity, and complexity, driven by demographic, technological, and healthcare changes. And we're seeing this on the state level as it becomes harder and harder to find direct care workers for our loved ones. It is crucial that our lawmakers understand the vital role that caregivers play in our health and social systems. And it's also vitally important to address the challenges and the needs that our caregivers face. Next, please. 7 in 10 working age caregivers were employed while they were providing care, and 6 in 10 employed caregivers worked full-time hours or more while providing care. Half of all working caregivers experience work impacts, such as arriving late, leaving early, or taking time off to meet caregiving obligations. Overall, go to the next slide, please. Sorry. So difficult tasks. Overall, providing support with ADLs can be taxing for caregivers. Among caregivers performing ADLs, nearly 1 in 4 say it's difficult to assist the recipient with these tasks. I know that was the case with my mother. She was a small woman. My dad was over 6'5", so training is lacking, even though many caregivers assist with a broad range of tasks, some of which can be very complicated. Very few receive any formal training on how to provide this help. The statistics are that only 11% of caregivers have received formal training to assist with activities of daily living, and just over 20% of caregivers have received formal training on medical and nursing tasks. Next, please. We've spent some time talking about some of the challenges facing caregivers, but how can we address these challenges? In this next session, I'm going to talk about a few ways that the private and public sector can provide more support to family caregivers and address some of the challenges that they face. Next, please. So the challenge of financial strain. Programs that offer payment to caregivers are critical because they help relieve some financial strain for caregivers, and they help address the shortage of direct care workers. Paying family members to provide care can also be helpful in very rural areas of the state where there might not be other services or providers readily available. A majority of respondents say that they would support a paid leave program to help compensate caregivers who need to take time away from work. Currently, 13 states plus DC have paid family and medical leave laws in place to do exactly that. Next slide, please. Idaho could implement a caregiver tax credit to help to that end. Oklahoma and Nebraska both have comprehensive non-refundable caregiver tax credits of up to $2,000, $3,000 if the care recipient is a veteran or has dementia. We are setting the groundwork for a tax credit bill to be introduced during the 2027 legislative session. Our goal was to introduce this bill in the 2026 session, but the budget shortfalls have changed our plans and would make it impossible to get that across the finish line. This is what is anticipated for inclusion in the 27 bill. And I realize that I have said the last point twice, so forgive me on that. So stay tuned for more on that bill. Next, please. Time. Although nearly 4 in 10 caregivers report that respite services would be helpful, only 13% of all caregivers use respite services. State and local government need to work to improve, one, knowledge of available respite services and address barriers that prevent caregivers from using that service, and provide funding for programs that provide respite services. Next, please. Working caregivers generally feel supported at work, according to the survey that I indicated at the beginning. But women caregivers, caregivers with lower household incomes, and caregivers without children under 18 in the home report less satisfaction with company support. States could work with business communities to develop incentives for implementing these policies that are on the screen. State and local governments could offer these benefits to their employees, and state and cities can consider paid sick and leave policies that would include caregivers and caregiving leave. Next, please. Caregiving in the US 2025 also found 33% of caregivers say it would be helpful to require a doctor, nurse, or social worker to ask about what you need to help care for your care recipient. 22% of caregivers said it would be helpful to require a doctor, nurse, or social worker to ask you what you need to help care for yourself. One way AARP has worked on this issue in the past is through the Caregiver Advise, Record, and Enable Act. Under the CARE Act, which is law in 43 states, including Idaho, hospitals must identify a family caregiver for inpatient admissions and record the family caregiver in the medical record. Hospitals must notify the family caregiver of discharge plans for the person in the hospital, and family caregivers must offer training on medical nursing tasks that may be asked to perform at home. Next, please. Currently, Idaho's guardianship and conservatorship statutes have not kept pace with best practices. We have been working, I've been working on this in the 2025 session, and we will be working on it in the 2026. But I believe this is will be the third legislative session that we are trying to get a rewrite of the guardianship and conservatorship statutes across the finish line. The current law lacks explicit recognition of less restrictive alternatives, has uneven procedural protections, and relies on annual reports that are inconsistently monitored, leaving vulnerable adults and children at risk of exploitation, while courts and families face unclear processes and inadequate oversight tools. Over the years, revisions have been made in the area of the law to create Idaho-specific provisions. Those provisions are still retained in the new bill. However, there are issues that needed to be addressed. These included standards of evidence, constitutional protections, the developmental disability provisions on conservatorship and guardianship, breadth of detail for plea, required methods of notice, transfer of existing guardianship or conservatorship cases from other states, and implementing least restrictive alternatives to a full G&C. So keep an eye on this bill. It will be in our next session. Next, please. Thank you. On the federal level, these are 4 bills that are specific to caregivers that are before Congress and have been for the past year. None of our congressional representatives are sponsors of these. So the Credit for Caring Act would provide a new annual non-refundable federal tax credit up to $5,000 on your federal tax returns. Lowering costs for Caregivers Act would allow people to use their pre-tax flexible spending accounts or health savings accounts on medical expenses for their parents. Alleviating barriers for caregivers would provide federal agencies the ability to reduce red tape and improve customer service. And the Connecting Caregivers to Medicare would require the Centers for Medicare and Medicaid Services to promote the 1-800-Medicare helpline to make it easier for family caregivers to get information for their loved ones. So I would ask that you ask your federal representatives to sponsor these bills. Next, please. So a few things that we're watching on the state level, budget woes. When I wrote this, I had 22.6 million. Now the projections are 56.6 million. So they've gone up quite significantly. So keep that in mind. That's going to have a ripple effect across all budgets. They've already started trying to bring that down by decreasing Medicaid provider payments. So keep an eye on that. I'm hoping that that doesn't decrease more than it already is. Agencies have already been asked to permanently cut 3% from their budgets across the board. We have 109 million in general fund supplemental funding requests already. That probably won't be able to be met. And these budget projections don't account for the cost to conform to the big, beautiful Bill Act. That is probably going to cost our state around 170 upwards to $200 million. So the budget's going to be a big deal this next session. So keep an eye on that. Ancillary things, we're hearing that they're possibly looking at repealing the grocery tax, which would again have a big impact on our budget. So keep an eye on that. Where we repeal one tax, we have to decrease payments or services on another end. So keep an eye on that. Medicaid expansion repeal is going to be another issue. All of our legislators are up for election, so I anticipate that we're going to have a quick and fast session in 26. They're looking at the ballot initiative process again, absentee ballots again, property taxes comes up every year. Oh, I've got that on there twice. I've been having a day with my slides, haven't I? It's on there twice. I apologize. So keep an eye on all of these. And if you have any questions, feel free to reach out to me or Brittany. Brittany's up to speed on all of this as well. Next. This last session, we spearheaded and got the report and hold law passed. Many of you probably have heard about this. This is just extra protection against fraud for your loved ones, especially as a caregiver. This is a big deal. I don't know how many people have called into our office whose parents or they themselves have been defrauded of money. What it does is it allows financial institutions, so brokerage firms, banks, credit unions, mortgage lenders, to hold back any transactions that they deem to be fraudulent for a certain amount of time. So it allows them to hold that back and then report that to the authorities, to Adult Protective Services, the Department of Finance, and law enforcement, so that they can do what they need to on their end to put a stop to that fraud. So that's where that comes from, report and hold. Yeah, go ahead. So this next session, we're going to be tackling virtual currency kiosks or crypto kiosks. Many of you have probably seen them or didn't even pay attention to them in gas stations, grocery stores. They are not regulated in our state, so are we going to have them regulated? There will be a limit on the amount of money new users can transact at the kiosks for the first 30 days, and that should help out with the flow of around $34 million that's lost every year just in crypto kiosk fraud. And that's just reported fraud. So keep an eye on that for this next session. Next, please. You're probably aware of the Rural Health Transformation Program. It's designed to strengthen rural healthcare systems, addressing critical challenges such as low patient volumes, workforce shortages, and outdated infrastructure. It was established under the One Big Beautiful Bill Act, and Idaho is applying for that. Many of us probably put in comments on how to utilize that funding, so stay tuned for more information on that. Next, please. So I want to talk about advocacy and using our stories for advocacy. Next, please. So advocacy is any action that we take to influence decisions within political, economic, and social systems and institutions. Elected officials need to hear from us. They need to know what laws, policies, or statutes are affecting you and how they're affecting you. Many times laws, as you know, are passed on the state level or the federal level, but when it trickles down and gets boots on the ground here, how it is initiated, how it ultimately end up happening to people in the state, sometimes isn't the same as what they were anticipating at the state or the federal level when they passed it. So our elected officials need to know how it's affecting you. And I always say, you know, get a hold of them when things are affecting you negatively, but let them know when things are good too. Let them know what policies and statutes are making a difference. They need to hear that as well. Next, please. So using your voice is so important. Our stories connect us to our audience, and our advocacy can help improve laws and policies and in beliefs as well, removes barriers, ensure our priorities are heard, engage communities and lift up our individual voices, improve our lives and create that personal connection. And remember that your experience is your experience, and you're an expert on that experience. And your story, you're an expert on that story. So let your voice be heard. Our elected officials need to hear from you. Next, please. So messaging is very important. When I first became a lobbyist, I had all my notes, pages and pages of notes. And I sat down with my first legislator, and I had less than 5 minutes with them. And I remember looking at all my papers and just like holding them up, like, what am I going to talk to them about in this less than 5 minutes? Like, what is the most important thing I could tell them? And I was not prepared. So I'm going to try to prepare you a little bit so you don't have moments like that. Next, please. So what's your headline? A good rule of thumb is that you have 5 to 15 minutes with your elected officials. Sometimes you have less. Sometimes you have walking from one committee meeting to the next committee meeting. So you need to know what your headline is. If they only hear one thing from you, what would that be? What is going to capture their attention so that they remember it? Next, please. You want to keep your message clear and concise. Emotional stories capture attention and hold it longer than dry, factual information. People remember stories that make them feel something. Emotions etch stories into our memories, making them more impactful. And stories that evoke emotions are more persuasive and make lawmakers more receptive to your message. Next, please. Build partnerships. So the Idaho Caregiver Alliance is a perfect example of a partnership with like-minded individuals around one common cause. Remember that there's strength in numbers, and there's also support. Yeah, that you have a built-in support team when you have partnerships with like-minded individuals. Next, please. You want to make sure that you choose actions that best fit your goal, whether that is just writing, if it's testifying, it's making phone calls. Make sure that you are talking to the right people, that you are asking questions as needed, and that you are being positive. Positivity is very important. Next, please. I like to say that we advocate with people, not for them. Respect individuals' autonomy, and most importantly, take care of yourself. Know what your capacity is and give yourself grace. Next, please. And then learn from your setbacks, reevaluate, pat yourself on the back, even if it's just a small win, and then move forward to the next goal. Next, please. So let's pull it all together. Next, please. So what can you do? These are just a short list of things that you're able to do. You can attend committee hearings, and you can testify in person, remotely, or in writing, attend town halls, coffees with Congress, listening sessions, where you can ask questions, verbalize support or opposition, and ask for changes, engage with the media, get news stories out there. Write news releases, letters to the editor, opinion pieces, do interviews, call, email, write, or start a letter writing campaign with your targeted legislators on your issues of importance, and set meetings with your targeted legislators. Build those relationships with your elected officials. with the like-minded organizations and also with your state and federal and local agencies. Next, please. So who are your elected officials? I think most of us know. They've been around for a while. Our senators are Crapo and Risch. Our congressmen are Simpson and Fulcher. Each one of them has their own individual website, which will show you also any events that they're attending that the public's welcome to go to. We have 105 members in our state legislature, 35 legislative districts, and there is a legislative directory that's available on their website. And you can get a hard copy. I think it costs around $3, or you can just have the free copy online. And then at the local level, the cities and counties each have their own websites as well, where you can see the county commissioners, who they are, and their contact information, the mayor and the city council. You should be reaching out to them as well. Many times you can get some things changed at the local level a lot easier than at the state level. There's not as much red tape. Next, please. So this is what the Idaho State Legislative website looks like. It's actually fairly easy to navigate. I've been on other states' websites and they're not easy to navigate. The three most useful functions on here is to identify your legislator, find your bill, and locate the committees for your bill or your issues. And if you have any questions about any of this, most anybody on this call probably could help walk you through the website. It's pretty self-explanatory once you get used to it. Next, please. This is my favorite quote. We cannot solve our problems with the same thinking we used to create them. So think outside the box, be an advocate for yourself and others. And please let me know if you have any questions or if there's anything that we can help you with, especially at AARP. And that's all for me. So I think the next slide has my contact information. Feel free to email me. I welcome any questions or any ideas that you have. And with that, I will turn it over to Brittany.
Thank you, Lisa. And we will take questions at the end of the session. So for those of you that have questions for Lisa, hold on to those. And Brittany, take it away.
Thanks, guys. Lisa did a phenomenal job. So I will just go ahead and, in the interest of time, keep going so we can get to that Q&A part. So I will, if you guys want to go ahead to the next slide, I do not need to highlight any of this because we already did a great intro, but the only thing I want to do with this slide was just to emphasize the fact that I do have, a background. We all do. We all have our own professional roles or whatever it is we do for a living. However, at the end of the day, my very bottom bullet shows that I am a parent of children with complex co-occurring disabilities. And when I show up to coordinate with legislators and things, a lot of the time, all of those other bullets don't matter. They're not relevant because at the end of the day, I'm showing up to use my voice. Most of the time, probably 99% of the time, sharing my experience as a parent. And so I think that's what I want to really, really emphasize and highlight here is that first and foremost, I am a parent of children. And so I'm a caregiver for them. And so next slide, please. So Lisa just highlighted this so beautifully, but I'm pretty sure you guys are going to get copies of our slides. And so all the things that are underlined are links. And so this first one is the link to the Who's My Legislator one that she'd mentioned. And so that will take you to, it's in that top right corner that had the little magnifying glass on that Idaho website, and that will take you there. So if you are not familiar with how to identify your legislators, it's that link right there. That'll take you to find them. And that's going to be your first step if you want to start identifying and working with your Idaho legislators. If you have not done that yet, if you're new to this, you're not behind the curve. It's just that's where you get started. And so, your first step is going to be, who are they? And what's nice about, as Lisa said, how easy this website is that when you go to that section, you literally enter your address. That's it. You enter your address and it pops up with who your representatives are. So your 2 representatives and your 1 senator per your district. And that's what's really nice is then when you click on them, it goes as far as to show you everything about them that is entered into that. And so it shows you what they do for a living, if they're retired, if they're employed, what they used to do. It tells you if they're married. It talks about, I'm trying to think what committees they're on. It kind of gives you a little nice snapshot about them, which is amazing because that's going to help inform how you connect with your legislators. So I always highly recommend, once you have that snapshot, if you really want to learn how to start connecting with them and engaging with them, maybe consider subscribing to their newsletters, right? All of our legislators typically have a nice newsletter they put out. It gives you a sense of the kinds of things they're interested in. If they're going to look at carrying any legislation this year, what that might look like. It tells you if they're going to be involved in community events, if they're going to hold a town hall or a coffee talk or anything like that, then you know what that is and where to show up. So you can find them. A lot of them will have their own little social media page. Lisa just mentioned about them coming up for election. So this year, if any of them plan on running again for election, you're going to see if they are doing that they're going to have their campaigns going. And so they're going to talk about being out in the community and what that looks like. And so now's your time to really start to get to know them and be present and make those connections. And so you'll see that social media page for them a lot of times, or in their newsletters. And so I really encourage getting involved with that and starting to make those connections. Next slide. Okay, so this is, I think, my biggest recommendation for anybody who really, really wants to start showing up and being involved with their legislators, is that legislators are people first. And so the most common thing I hear from people when they start to say, from caregivers, from parents, from individuals themselves with disabilities, when they say, I want to start advocating, where do I go? What do I do? Is that they're scared to reach out to a legislator because of the number one reason I hear, at least, is because they're an elected official. And that feels scary sometimes at first. And the reality is they're just people. They're your neighbor. They were a teacher, or they were a million different things, right? But they're first and foremost a community member, a neighbor, just another Idahoan. And they also want to be involved in advocacy in some direction. And that's why they chose to run to be a legislator. And I think that's what we all need to remember at the end of the day, is that they're an Idahoan who also wants to make change. And they just chose to go about it a different way. And that's why they ran to become an Idaho legislator. And so if we remind ourselves that they're Idahoans and they live in your district, and they might be teachers or farmers or own a business or be an attorney or a first responder, but they have, a significant other, or they're a parent of a child, or they're a caregiver for their parent who's aging, but they're a community member somewhere in your area. And first and foremost, if you remind yourself that, it feels a lot less scary to reach out. And so that's my biggest tip, because once you can remember that, it doesn't feel as daunting to have to reach out to a senator or a representative. And when doing that, and then if you go back to, like we just said, right, if you look on that Find My Legislator and you get all that information, that really helps, because then you can find where's your common ground. So when I look at my district, I live in Blaine County. And so where I live, my senator is Ron Taylor. So Ron Taylor is a retired first responder, and he volunteers for our crisis hotline. So when he first was not elected as a senator, I reached out to him knowing all of that about him. Well, he's a retired first responder, and I'm technically a first responder because I do all of our suicide response and post-vention response in all of Blaine County. So that was what I had in common with him. So when I sat down for coffee with Senator Taylor, it was something we had in common that built our first connection. Now, several years later, we continue to have an open communication, and we talk regularly. I invite him to events. He comes, he calls me, we talk all the time. But that wouldn't have happened if we didn't have something to connect over first. And I did the same thing with my representatives, Representative Nelson and Representative Pohanka, both of whom coincidentally are retired college professors. Knowing that about them, that's how I started. We talked about their experience as college teachers and educators and what they liked, what they didn't like, what their spouses do. Representative Pohanka, coincidentally, is a chaplain for Idaho State Police and the Jerome Sheriff and Police Department. I was able to connect with him on the first responder side in my work with police, and he's huge in volunteering, and I volunteer all over the state, as well as for the Special Olympics ski team here in Blaine County. So we were able to connect on different things. by connecting and forming a relationship with them, it made it so much easier than during the legislative session when there's policies to discuss and things to talk, that now I have a relationship with them and I can reach out. And it doesn't come across that I'm just reaching out with concerns, with comments, with things I want to discuss, even if it's a solution-oriented conversation, because there's somebody I know now. It's somebody I have relationships with because we connected first. So my biggest tip would be find your common ground. Take the time to get to know them, find your common ground, and then form that relationship, because it'll pay off come the legislative session. Next slide. So what is effective advocacy? So we want to turn our passion into advocacy. So we need to be concise, clear, and focus on one issue at a time. By doing that, our stories will be heard. As Lisa showed, there are so many things happening. There's so many issues that we might want to focus on and share. But if I were to call Senator Taylor or one of my representatives, or even the other legislators across the state that maybe that aren't in my district that I have relationships with during the session, I can't talk about 15 issues at one time. And like Lisa shared, sometimes you have a walk down the hallway. So if I have a walk down the hallway, what am I hitting in that moment? Hey, before you go into Health and Welfare's committee this afternoon, I want you to be aware of this with this bill today. And I have to be clear and concise. I also need my story to be clear, and I need it to be emotional and effective, but it's also really helpful if they can understand that it's not just about me. It's not just about my family. How is this also going to be impactful so they can see that this is a larger system issue for other individuals in the state? How can they understand that? Because it's not likely that they're going to be willing to change an entire policy for one individual, but they'd be willing to consider that if it's going to impact Idahoans across the state. So that's important too. I also would tell you that collaboration is huge. And so if I come forward with solution-oriented conversations, that's going to go a lot further than if I'm just calling them whining. So I will say that anytime I can come forth and say, hey, I've noticed that this isn't working, but we have seen this be positive in other states. We have seen that this really works. As Lisa said, don't just share the negative, share the positive. So anytime you can come forward with solutions, with positive conversations, that's going to be more impactful and work out longer term. Next slide. So this one I really want to emphasize. Not getting a response doesn't mean you're failing. Legislators get tens of thousands of emails, of calls, of messages, of everything all the time, especially during the session. So we've done a lot of work over the years. I work with a lot of community partners, and there are times that sometimes we don't get a response to an email, to a text message, to a call. That doesn't mean that we failed. Silence doesn't mean you're not getting things done. There are times that maybe that wasn't effective. There are times that we've drafted policy that was successful and it went forward and we celebrated. There are times that our policy failed. Doesn't mean we failed. It means we try again in a different way. Sometimes we have to be willing to pivot, and that's how we continue to persist without having our burnout. I would really highly recommend that maybe if one way isn't working, try it a different way. Sometimes email isn't effective. Maybe try calling, or be willing to show up in person. The biggest thing is the legislative session is really overwhelming, not just for legislators, but for also individuals who are trying to keep up during the session. So I think what is the most effective that I've found, and I think others would agree, anybody who's actively involved would agree, is outside the legislative session is the most responsive. So if you can connect with your legislators, like even right now, outside the session, have coffee with them, meet them in your community, you're going to have the most connection now outside of the session. So I highly recommend that. Advocacy is a really long game. So the relationships I have with my legislators didn't happen in 1 month. They didn't happen just during one session. The relationships I have now with legislators across the state was built over years, over time, over longevity. So take the time and let it happen slowly but surely, and be persistent, but also step away when you need to, and know that there's other people in it with you, and it's okay when you need to take a break. Next slide. Okay, so here's some legislation I thought we could look at for a few minutes as caregivers. So it does say recently enacted. And I want to be clear that the first one isn't so much recent. However, we do see a lot of hiccups with it still across the state. So we thought it would be important to just make note of it. So in this first column, you'll see that it has what would be the House bill or Senate bill number, because a lot of times I'm still noticing that these pieces of legislation are still referred to that way, even though now they're obviously in Idaho code. So I wanted to put both just in case some people might be more familiar with hearing them as one or the other. Again, that second column has them all hyperlinked. So that is actually where the actual codes are found. So this first one was put into legislation in 2021. It was an amendment to the Children's Mental Health Act in Idaho Code. This was done with a group of parents and an attorney from the Jeff D. lawsuit, which is what created the Children's Mental Health System of Care. We worked on this one to help protect families and children with significant behavioral health and it's in the Children's Mental Health Act and cross-references the Child Protective Act. So parents of children cannot be found substantiated on charges of abandonment and neglect for seeking out-of-home care for their child due to recent deterioration of their child's mental health. So if that child needs out-of-home placement, meaning a residential care, a psychiatric hospital, something like that, if that child is currently unsafe for themselves or others, that parent can't be charged or found substantiated for abandonment for seeking that hospitalization care. That still happens to this day. It is still threatened by hospitals. It is still threatened by entities, Child Protective Services. And so we work routinely hard to make sure that these children have access to care, because that doesn't happen in other worlds. It doesn't happen if your child has a medical complexity, that doesn't get threatened. But children with mental health, that's often threatened. So we work closely with law enforcement on this. And currently we're working to actually have it added to the law enforcement code book that is put in all law enforcement vehicles across the state so that they can have a quick reference guide. But this one, we want parents to know that as caregivers, if your child is in need of critical care, that you have rights. You have rights to ensure that you will not be charged. Your child has a right to get care. This next one, the powers and duties of teachers. This one was first put into place in 2023, but again, amended again in 2024 for further clarity. This one just has, this one was put into place to ensure that teachers could not, or any school district staff across the state could not use restraint and seclusion as a form of discipline in a school setting. So this includes medical restraint, physical restraint, things of that nature. Schools have to adopt these policies, train their staff, and they have to log and report this to the families and to the State Department of Education each year. So this protects our students. There are a lot of clarifying language within this that does state that if a child with a individualized education program has a behavior intervention plan that requires for safety, that there is a physical escort, but there are a lot of very very strict parameters around that to ensure the safety of the child so that the child can't be harmed either. So I think as caregivers, that's an important one for parents of children to know because we learned that children were being harmed or secluded. The next one is the parental rights and medical decision-making. That one has been a hot topic conversation, I think, as many people know. So that one mandates parental consent for youth medical behavioral health across the board. Prior to that, children over the age of 14 had their own rights in mental health care. No longer is that the case. This allows the parents to have access to all records and have to consent to all things. This has created some difficulties, such as if a minor was pregnant or things of that nature, because they cannot make their own medical decisions. This also has created some confusion on if a child were to travel during a sports event during high school. If the parents aren't there and the child maybe had a concussion in a football game is a good example, then what does that mean? Who can treat the child at the away game? So there are some other nuances with that, but I think it's important people understand that one. And the final one is the denial of school attendance. This one happened this past legislative session. This permits schools to refuse enrollment or expel students for habitual truancy, disruption, or safety risk without requiring less restrictive supports first. This one cross-references the Juvenile Corrections Act, and it does mention specific crimes that a child has been charged with as a potential to not be enrolled. I would give an example of a victory or a minor victory, right? Doesn't mean you're not successful sometimes. And so one thing is when it was on the Senate, we were able to have it sent back in the Senate Education for an amendment in which they were able to cross-reference the Individuals with Disabilities Education Act to ensure that children who may be suspected as having a disability would be assessed. And so that way we wouldn't be at risk of having children not be assessed for potential disabilities and needing of treatment or needing of services in school-based settings. So while there is still some potential harm with this, at the same time, we were looking at it as a victory of some kind because at least we included that language. So sometimes your victories aren't what we were looking for or hoping for, and they're smaller in scope, but we take what we can in some cases. Next slide, please. So a couple things I wanted to highlight that are coming next. A year and a half ago, we made a request to the Joint Legislative Oversight Committee for a report through the Office of Performance Evaluation for oversight in children's residential facilities. This was a victory in itself, as our systems were just set up in a way that there were gaps. And so children in residential facilities didn't have the same protections as they did in the home settings. In the home settings, families and caregivers are held accountable to Child Protective Services to keep our children safe. In the residential settings, there was a significant gap between law enforcement, licensing, Department of Health and Welfare, and there wasn't a good way to ensure oversight and safety for these children. We were able to successfully have this report conducted, and the results came out recently. So now that this report is out, which is linked there, and it is a very lengthy and in-depth study on it, we are hoping to have some legislation aimed at closing those gaps to ensure effective safety for children who need residential care and treatment. The parental consent bill that was mentioned on the last slide, there are proposed potential clarifications to help address those gaps within that. I'm keeping that really broad because that's still in discussion, but there were at the end of last session some draft proposals for that, and so it's anticipated to occur this year to help fix those gaps. And lastly, I would touch on the Medicaid transition to managed care. The Medicaid Advisory Committee has been meeting and working on the oversight with the Department of Health and Welfare as Idaho transitions to managed care for Medicaid, all Medicaid. And I would highly encourage individuals who would like to ensure that their voice is heard in that, as the listening sessions occur throughout the state, to really take advantage of that and ensure your voice is heard, because the Medicaid Advisory Committee doesn't know what they don't know. And so they don't know what your experience has been, and they won't know to include that in their request for information prior to putting out the proposals of that transition if they don't hear from you. Next slide. And then lastly, I would just say, stay involved, right? Sign up for updates and newsletters. The AARP, right? The Idaho Caregiver Alliance, entities like that have amazing newsletters, and especially during the legislative session, normally they're weekly, that has amazing highlights. Tracking legislation can be a lot, and it's very difficult to do. And so really relying on the newsletters of amazing organizations can make a huge difference. And so if there's a specific topic of interest, signing up for the newsletter from that entity can be huge, right? If education is your interest, perhaps signing up for the Idaho Parents Unlimited newsletter. Finding whatever it is that interests you and using their newsletter to help track things can really lift the burden from you, but help you stay informed. Attending those town halls or community events, if you learn about them, and just making sure that you're able to voice those things. And so again, collective voices creates our real change. We all can't know everything, so we share what we can. And next slide, I think that might be it. Oh, this was just my little pep talk, right? Like, we can't do it all. We're going to celebrate our small victories and lean on each other. Several of us text each other during the session pep talks because that's what we need to do. And so we're all in this together. And remember that you're making a difference, even when it doesn't feel like it. And last slide, and that's just my contact information. So happy to reach out or help out however I can.
Thank
Brittany, that is a fabulous presentation. My brain's exploding with what you've prepared. And I really like the way yours and Lisa's presentations really came together as well in terms of, you know, you have your own story, but you also put that in the context of the larger community. And I think that information from the national survey that's just been conducted on family caregivers is really helpful in highlighting the breadth of the caregiving experience and the impact it has on families, on economies, on the ability to maintain employment is so important. So really nicely put together. I think we're a little short on time. We have some questions in the chat. If people would like to continue to put those in the chat. Before we take questions though, I just want to do a little promo for a really easy action step that we can all take that will raise awareness, celebrate a success, and connect you with your local legislature. So Sheila Weaver is working diligently on having the governor recognize November as Idaho Caregiver Month. It's the national recognition and celebration of family caregivers. That would be a wonderful opportunity for you to connect with your local legislator and just say, hey, Governor Little is celebrating National Caregiver Month as here in Idaho. I'm a family caregiver. I'd love to meet for you to get together with you to talk about issues that are important to you and to us. You know, a really easy ask. It raises awareness and it celebrates, I think, a shared commitment to supporting families in Idaho. So just want to give a shout out to November is National Caregiver Month, and it will also be Idaho Caregiver Month if all goes as planned. So stay tuned for that and use that as a potential opportunity for you to easily connect with your legislator in a fairly, non-threatening way, celebrating family caregivers. So with that plug, we have a couple of minutes for questions, and I think there is one in the chat that I saw. Sheila, do you have that question pulled up by chance in the chat?
I do. Yeah. How does managed care transition impact certified family homes?
Brittany or Lisa, I'll let.
That's a good question. I don't think we know actually yet. I think the state, under the managed care, the state's going to probably have to renegotiate and redesign those contracts. So I think, like Brittany was saying, it's really important that you're part of those discussions. So they, like, moving forward, they know what those look like. That's also going to include what the quality metrics look like, reimbursement rates. So if those are things that you should be concerned about, which we all should, make sure you're part of those conversations. Brittany, did you have anything to add?
No, Lisa, my answer is going to be the exact same. We don't know at all yet. I think the only thing we do know for certain that I have heard from leadership in the department is that the developmental disability waivers for both adult and children will be the last one to transition into the managed care component officially. That being said, it hasn't been decided yet, and the RFI has not gone out, or the RFP, which will be the official when the managed care entities start putting in their submission. So I just highly emphasize anybody, please participate when they start coming around to your areas of the state. That is what's going to inform what goes into the contract for the entities that will become the managed care holders for Idaho.
Building on that, those changes coming forward, nationally, Medicaid is now going to be enforcing a employment, that folks have to demonstrate their employment to receive Medicaid benefits. Family caregivers are able to use their caregiving work as evidence of employment. But I think for all of us to attend those Medicaid hearings and help Idaho put together a realistic and efficient way of documenting employment is going to be really important. What we don't need is another layer of paperwork and confusion around how we demonstrate meeting a work requirement. And so I think these hearings that are going to be going up, or information sessions going around across the state, will be very important for us to participate in and speak to a variety of issues that impact family caregivers. Sheila, are there other questions in the chat, or can
I think that was the one in the chat. I'm just going through real quickly, and yeah, just to verify again, we'll send out all the slides and everything. But yeah, other than that, I don't see anything else in the slides.
Wow, well, holy cow, we're at 1 o'clock. That's pretty good timing. Yeah, again, I agree, Stephen, Dr. Monamat, presentations were both excellent. We encourage you to take a moment and fill out the evaluation form. We use those to guide what we do next for our quarterly seminars. And we will send out the slides to all of the participants, and we encourage you to share them with others as well. Thank you very much. Great to see the accolades coming in through the chat. Congratulations, Brittany and Lisa. You did a marvelous job.